Thank you everyone for joining us today. My name is Priscilla. My pronouns are she, her, and I'm with the UW Medicine Office of Healthcare Equity. Thank you again for joining us for our COVID-19 community conversations. I will be putting a link in the chat where you can view this recording on our COVID community conversations strikeout page, as well as the video will be uploaded to YouTube, and a link will be there as well if you'd like to share this after this session to your family and loved ones. I'm going to turn this over to Dr. Chopra for introductions.
Thank you, Priscilla. Good afternoon, everyone, and welcome to Community Conversations by UW Medicine. Today, I'm really excited because we will present a really important discussion centered around guidelines about masks and testing for COVID, including home testing. I know all of us have a lot of questions, so we have our experts here and they will be giving us really practical, basic guidelines around these two important topics. I'm Anita Chopra. I'm an internal medicine physician at UW Shoreline. I'm joined today by our infectious disease experts. First, we have Dr. Santiago Nemi. Dr. Nemi is Medical Director of the UW Medical Center Northwest. He is Senior Associate Medical Director of UW Medical Center and Vice President of UW Physicians. Most importantly, he is our most visible scientific voice, and we love getting practical tips and updates from him. We also have Dr. Margaret Green. Dr. Green is Medical Director, UW Medical Center, Northwest Wound Care and Hyperbaric Center. She is Chief Infectious Disease and Travel Medicine at UW Medical Center, Northwest. I also have Priscilla Estrada, who is Community and Workforce Engagement Specialist, Office of Healthcare Equity, UW Medicine. Thank you so much for joining us, everyone. So let's talk, start talking about masking. And I'll start off with Dr. Green. Dr. Green, why is it imperative to mask at this point when most of us are vaccinated?
Right.
Why is it so important to continue masking?
That's a great question. We have seen that the vaccination and booster does prevent some infection, but Omicron is much more contagious and easy to spread. And we know that the time of maximal spread is from 1 to 2 days before you have symptoms until 1 to 2 days after. And so that time where we are potentially infected and able to spread it is a time where masking is so critical, and it means that the quality of your mask also has to be very good. So even though I'm vaccinated and have a booster, I'm going to wear a mask all the time to protect myself, to try to prevent getting infected, but also to protect my community in case I happen to already be infected but don't know it yet.
Thank you so much. And Dr. Green, does that apply to adults as well as kids?
Absolutely. Right. We still have a lot of kids who can't be vaccinated yet because we can only have vaccines for those who are 5 and up. I have in my household a 4-year-old. So yes, she is masked everywhere at this time. And it's mostly, again, to both protect. And when I talk to my son about why we're masking, it's to protect our community and to protect our family.
Thank you. Dr. Neme, all of us are, invested in cloth masks in the beginning of the pandemic. Are they still protective? What kind of masks would you recommend? And could you please talk a little about the different kinds of masks available to us today, and what should we be choosing?
Thank you, Dr. Chopra. It is a pleasure here to join you, and Dr. Green. Hi, everyone. The cloth masks have been found to be inferior in terms of protection against Omicron primarily. The reason has to do with more recent data that shows that the more layers you include in your masking and your mask, the better protection you have. With the cloth mask, what we're seeing is that they're made of different materials, and oftentimes they don't have enough layers. So therefore, they're not preferred anymore. And if you see a cloth mask, it should only be to protect the mask right under it, as opposed to the sole protection you have, because it will be inefficient and insufficient. So not enough. there's a lot of masks out there that people can buy, and soon we will have the ability to request free masks from the government. But there's two things that I would like to highlight. It is not only important what the mask is made of, it is really important that the mask has a really good fit. That is, if my mask has gaps on the sides, that's not a good mask for me. No matter how thick the layers are or how many layers, if it's loose, it's not going to cover, because there's going to be air coming through the gaps. So the fit is really important. The number of layers is really important. We recommend 3 or more layers now. If you have masks of fewer layers or that are really thin, you can double up on that as a step towards better protection. In terms of the higher quality masks that we have the KN95s, which you've probably seen. They kind of look like this one that opens up and then you place it. The idea again is that it's snug and that it's wearable. You don't want that to constrict your nose too much, but you don't want a gap between your nose and the mask or the side of your cheek, or again here at the chin. You also have the KF94s that are really comfortable. This is the Korean variety of KN95. This is KF94, and they're more elongated. They're very comfortable. They fit a bit more naturally. And Priscilla is actually demonstrating there. You can see you have adjustable earlobes, because again, let's just say I have a very small head. I'm gonna want to tie a knot here to make sure that it's snug enough, right? I need it to be snug. Dr. Chopra basically is also adapting her mask, where she actually created a cross path here to increase the tension, but not so much that she can't breathe or is feeling a bit asphyxiated by the mask. You can also see that most people who wear surgical masks are wearing another mask underneath, as we said. So I would say there's KN95s, there's KF94s, there's, I'm grabbing now a respirator made by Honeywell, again, one of the companies. And what you can see is that instead of the ear loops, these are attached to the back of your head, more like an N95, right? Like this. And then, well, I made it not here, but the idea is that this goes over. And they have a bit of a foam here for extra comfort. But the key thing here is you want 3 or more layers. The KN95s have 5 layers, and so do the KF94s. You can't really see the multiple layers because they collapse, but there are several layers. And again, the fit. And number 3, especially when we talk about kids, they need to be able to wear the mask. It doesn't work if you have something rigid that the kid won't be able to wear for several hours, let's say when they're in school. And also the important reminder is that kids under the age of 2 should not be masked because of the risk of asphyxia. That's the only exception to masking.
Thank you so much, Dr. Neme, for giving us this important information. Looks like, there is so much benefit to upgrading our masks. Dr. Green, where can people buy these masks? So we have access to, in healthcare, as healthcare providers, to the N95 and the KN95 masks. We are double layering at, in clinic. What about, people in the community? How can they, get hold of these upgraded masks?
So I would say I was looking for my own family a few weeks ago, and it was very hard to find them. And it seems like, at least in the last week, it's been a little bit easier with supplies coming in. I don't know if it was the combination of the weather and everything else and Omicron. But, I've seen them now in grocery stores, in pharmacies, and looks like Dr. Neme is putting up other places that you can order them online. Other online retailers do have them. Just be aware, I think there have been some online marketplaces where the prices have gone really high, and it a little bit depends on the demand that day. And just, these should not be expensive. And so if you're looking at a product and it looks like you're having to pay, several dollars per mask, keep looking, because I think you would be able to find them in a cheaper and more reasonable price. Also, a lot of community organizations are also starting to get bigger stocks to be able to give to community providers. So I've seen them at different shelters also getting some to actually give away to the public. So we may be seeing more of that.
Yeah, and remember that if you, I put some links there, as Dr. Green mentioned, if you just have a surgical mask, remember that you could also put a cloth mask or a second surgical mask on top to create more than 3 layers in this situation. And that's going to help. Typically, the cloth mask can help you keep everything contained and more enclosed, rather than the protection itself is an extra layer, but it's also a way to keep everything together.
And Dr. Green, could you also talk a little bit about kids? How can we protect our kids when they are going to school? As you know, kids are sometimes not very good about keeping their masks on, especially the younger ones. How can we ensure that they are protected? Should we also give them KN95 masks or KF94 masks?
The sizes, I think, for children's masks for KN95s are a little bit more restrictive, and they don't seem to fit a lot of kids as well. My son finds them incredibly uncomfortable, and so I've lost that battle. But there are, in terms of all of the layers of things that we're doing to protect our kids, if your child is old enough to be vaccinated, please do get them vaccinated. If they're in school, hopefully their school is doing a good job in communicating with you as families and also within the classroom about social distancing, keeping their masks on, and limiting the number of children that they're exposed to. And then communicating when there are possible exposures so that you can monitor your child for symptoms. And then, of course, if you feel like that's a lot of risk already of just going to school, then thinking about how you can limit exposure outside of school so that they're not kind of layering risk on top of risk on top of risk. And that sometimes is, restricting to outdoor play dates, or limiting the number of group activities that they participate in. For my own family before Omicron, my sons, I started to take them occasionally to the swimming pool at the YMCA, but you can't be masked in a pool. And even though they were restricting the number of people, we decided we had to stop doing that until this is better, because the risks are too high. So it's just thinking about what your risks are as your whole day. And if you're worried about school, do as much as you can to protect them while they're at school, but then thinking about what's happening outside of school and seeing if you can get rid of some of the risks there.
Thank you so much. Dr. Nene, I would like to switch gears a little bit and talk about vaccination. With the current wave of Omicron, why is it so important that people get their boosters and not wait for the Omicron specific vaccine? Should they be waiting? Is actually my question.
Yeah, the answer is no. People should not wait for the Omicron specific vaccine. People should go ahead and get boosted as soon as possible. The reason is that we have tons of data now that show that the protection after booster is literally boosted significantly. And when you see folks who were only vaccinated with 2 doses, that is their full vaccination series, for an immunocompetent person, right? We know that for immunocompromised people, the primary series includes 3 doses, but for immunocompetent it's 2 doses. So we've seen that in those folks with 2 doses versus folks with the additional booster, those with 2 doses had inferior protection against Omicron and were more likely to end up getting severe disease and end up in the hospital. So again, the booster is really important to increase the line of defenses and therefore do what the vaccines are really made for, which is to prevent severe disease, hospitalization, and death. That's the main objective of vaccination. And the research, time and again, has shown that getting a booster makes a significant difference in terms of how much protection you have.
Thank you so much. So just underlining what Dr. Green and Dr. Nemi said, that we are following a layered approach. Masking is very important, social distancing is very important, but it is also critical to get your boosters. If you've had 2 vaccines, that's not enough. Please go ahead, get your booster. Also get your kids vaccinated, those who are the age of 5 and above. Now, shifting on to testing. Testing is a big hassle for people. They have not been able to find where they can go to get tested. The PCR test they know is the best, but they cannot find places to get tested. Are the over-the-counter home antigen tests good enough? Dr. Nemi, can you please talk about that a little bit?
Yeah, thank you. Just one more thing about vaccination. A lot of people ask me if I'm healthy, why do I have to get the booster? Why do I have to do all these things? And it's exactly what Dr. Green said. It's really about the vaccination is not a singular practice. It's a collective practice. It's for the community, it's for everyone. So this is not something I do for myself. This is something I do for myself and my community. So that's why we really need to get as protected as possible as a city, as a community, especially knowing that there are some folks like immunocompromised folks who do not mount a significant response to the vaccine, or kids who are unvaccinated. And also some people who have decided not to get vaccinated for one of many reasons. Again, we want the community as vaccinated as possible. And it's not only an individual decision, it's a plural decision. In terms of testing, rapid, and I want to distinguish rapid testing, right? So rapid testing, there's 2 kinds. A PCR test can be rapid. So there could be a rapid PCR test, which are the tests that can be resulted anywhere between an hour and 4 hours. But what we're focusing on, I think what Dr. Chopra asked me about, is the home rapid antigen tests. And these are tests that have been shown to be really effective at really diagnosing an infection earlier, because we know that the PCR test, you need to get the appointment, you need to go, you need to have the test, and if the test, if too many people are getting tests, then you're going to see a delay in the results. So you might need to schedule the test on a Monday, then go for your test on a Tuesday, and then hear about the test on Wednesday or Thursday, and sometimes Friday. So it's been 5 days. Whereas with the test like this, a rapid antigen test, you can actually have the results in 15 minutes. There are different kinds, and we can talk about this, but the key concept around rapid testing, and especially antigen testing, is that they're more accurate if you have symptoms consistent with COVID. They're less accurate if you don't have symptoms and all you've had is an exposure to someone with COVID. So this is why we always advise a rapid antigen test result is helpful if it's positive and you have symptoms. If you have symptoms and the test is negative, you might have a false negative. That is, there's a 15% or so chance that the test may be inaccurately negative and you're actually positive. So then what we seek, that you can take 2 paths here. If you have symptoms and a negative test, you can choose to repeat the test. Oftentimes the test kits come with 2 tests, or you can get a PCR test. So that's really important. And since we have a little bit of time, I want to just conceptually show you. So this is the test that you can actually sign up for and get free of charge from the government through the postal office. You actually get 2 boxes per person, and there's 2 tests inside this kit. You also have the FlowFlex here, which it's a very similar test that actually UW Medicine is launching at our mobile sites as well to get people tests, because we know that it's been really hard to find tests even to purchase, and some people cannot afford to buy tests for their families. Globally, I would say that these tests have the principle of having either a card or a tube where you actually have a control section and a test results section. The control is something expected in most tests that shows you that the test is actually reacting, that there's an engagement between the sample and the card, which is the reader. And then you have the test result, which is usually the T, and any line around the T is a positive test, no matter how faint it is. So be sure to look at it carefully with your reading glasses, maybe a magnifying glass, to make sure that you have no line under the test line, but you always have to have a control line. If you don't have a control line, you're going to have to repeat the test. So I'm going to put in the chat links to videos for these tests, and also the link to order your test. Again, these are the rapid tests where you can see I put the Binax now. I put the iHealth, which is the one the government is sending. But you need to sign up, and I put that website. And then the FlowFlex is this one. They're all really good. They just need to be FDA authorized, not approved. They have to be authorized. If approved, even better. But approvals take time. But when it says authorized, is all you need to know, and then buy the test and follow the instructions. For those who have either limited English proficiency or need the instructions in different languages, you can actually Google this information, and it will come up in several languages. Even the videos have links to other languages. So, but the key is, sometimes when we buy a table or something at IKEA, we want to play with it and we want to figure it out ourselves. Don't do that with this test. Read the instructions, because it's likely that you will mix up some things and then the test will not work for you. So please read it as opposed to figuring this out, so then you don't have to waste the test.
Thank you, Dr. Nemes. So a lot of people, they've got those 4 precious tests from the government, but should they just check, just for the sake of checking, or should they check when they are symptomatic? Because a lot of people are just doing it for the sake of it, and then they are out of the precious 4 tests.
Yeah, I don't know if Dr. Green was to answer this, but we really recommend to test with symptoms. This is where these tests are really helpful. These tests also have increased sensitivity, meaning they're better in the asymptomatic, but only if you do them serially. That is, if I have unlimited amount of testing and I want to do many, many tests daily, it might have a role. But for the general public, that makes no sense, right? So we need to really use a test when we have symptoms, and it's very actionable when it's positive. That means within 15 minutes, I can get a test result and then I can act on it. If it's positive, I act on it and I isolate myself and I prevent infections. I call my boss and say, I'm not going to be at work today because I have COVID. And then you isolate from your family as much as possible in terms of not sharing the same space. And if it's impossible not to share space, you really want to be excellent at masking, including with your household members, because again, you now have COVID. So it's really important. And instead of diagnosing this infection days later, I'm able to diagnose the infection now. If negative, remember that you might need either an extra rapid test, antigen, or you might need to stop by UW Medicine or any sites and get your tests, which again, they're the highest sensitivity, the highest quality. And now, fortunately, there's some there's more access to testing right now than we saw a couple of weeks ago. So that's really reassuring.
Thank you for that information. So if there is a positive test, then that automatically means isolation, calling your provider to get further instructions, and then just waiting and watching for your symptoms. Dr. Green, let's say someone has a positive test. At what point should they seek medical help? Because I know that a lot of our patients, after they have a positive test, they are either trying to get in to see their doctor, which they cannot because they may not get an appointment, and then they choose to go to the ER, which is already strained. So what should the next step be when at what point should they be seen by a physician? What
Yeah.
should that threshold be?
Thank you. So if someone, is a generally healthy person and not on any medications or have any diseases that put them at, increased risk or immune compromise, then they should just stay at home and treat it as they would a typical cold, monitoring for their symptoms. If they have aches and pains or a headache, fever, it's okay to use Tylenol, those kinds of things, drinking plenty of fluids, all of the usual things. And then seek care if they develop more serious symptoms, such as, inability to really eat and drink enough, or shortness of breath, cough. In elderly people, we often see extreme weakness. And so if they're not able to really get up and care for themselves anymore, these are the reasons to seek medical care. But if you're either asymptomatic or have very mild symptoms, I think, most commonly right now, I'm hearing from people, it's like a mild sore throat and maybe a runny nose, symptoms that they didn't even think could have been COVID, but they did the right thing and got tested. Those people don't need to see a doctor. People who are immunocompromised might be eligible for some treatments. And so they probably should reach out to their doctor either by phone or MyChart or something to just let their physician know and see if they would be eligible for any treatments that might prevent that progression of disease.
There's a question in the Q&A. Dr. Neme, would you recommend rapid testing of all before an outdoor gathering that includes high-risk people like grandparents?
In general, what I would say is the general rule that I've been following is that I avoid any non-essential gathering, right? So if it's something that if I'm meeting with my grandparents and I can postpone it, that's the number one choice. If the meeting is unavoidable, of course, I would recommend pre-meeting, and I'm not talking the day before, I'm talking about right before I'm heading to see my grandparents outside, I would get tested. Why do I say outside? Because when we socialize with family, we can create a space of higher density when we're talking, when we're having a drink or something. And we know that Omicron is very transmissible. So I would say option number one, does this meeting really need to happen? Number two, if it really has to happen, then I would get tested before going, with the understanding that there's limitations, because if I'm planning on meeting with my grandparents, I would have to be completely asymptomatic. I would have to have no symptoms, because if I have symptoms, game over. I don't see them, right? So if I have there's a limitation in terms of the test reliability if I'm having no symptoms. So just understanding that there's a little bit of risk still, because the test could be falsely negative, and I could be in the process of increasing the amount of virus in my body from a recent infection.
Dr. Green, are PCR tests as accurate for detecting Omicron as they were for Delta?
As far as we know, yes. So our PCR test is picking up all of the relevant infections.
So the effectiveness of the test is the same for Omicron?
It's the same for Omicron as it was for Delta, as it was for the previous variants. Yep.
Thank you.
And which is still very good,
Dr. Neme, should two people in the same household, like a couple, should they be sharing the same swab at home for home testing?
Not at all. No, swabs are supposed to be individual, And again, although we see high transmission rates, like about 50% of transmission within the household, is not 100%. So I would, the minute one person is positive, do not assume that the person next to you is positive. Do assume that the person has high risk of having a positive test or infection. But it's really, it's the wrong message to be sharing the same swab because it virtually, when it comes back positive, I won't be able to delineate who has the infection and who doesn't. In addition to the hygiene aspects of sharing a swab.
Dr. Green, how long does can a patient test positive for COVID? What does it mean? What is the mean time for negative testing after Omicron symptoms appear? So on an average, how long can they have a positive test?
It depends on what test you're using. So the rapid test will become negative sooner than the PCR test. And we can definitely see that PCR, although we don't routinely recommend testing for negative, can last for longer. And it's unclear whether that virus is still infectious or if those are just remnants of the viral genome. But the antigen test is usually negative for a mild case or asymptomatic case by, probably 2 to 3 days after the symptoms are resolved. But it's variable and we don't have complete data.
Yeah, I completely agree. I wanted to add a couple of aspects that come up a lot, which is if I have symptoms and my rapid antigen test is positive, no need for any further testing, right? Don't go and get a PCR to confirm that infection, symptoms, and positive rapid antigen test is confirmed. No need for anything extra. The same thing, I'm positive, as Dr. Green said, do not seek a test of cure. Do not seek to have yet a negative PCR, because as Dr. Green said, that can lag behind and I could be picking up RNA, like genetic material for the virus that maybe the virus is probably completely dead by then, but I'm still having a positive test. So no need for that. The only test that I would get a PCR if my rapid antigen was negative, and if I have the time. But the other option is to say, I have symptoms, my test is negative, but I had a clear exposure, I'm having symptoms, I have it, and then just behave as though I have COVID.
So then, Dr. Nemec, can antigen testing become useful for clearing patients to go back to work? Would that be reasonable?
We've looked at it, and it's not super helpful because again, you need to get the test to the person. The person would have to do the test in the time interval, and for some people it may still be positive. For some people it may be negative. So we actually have moved away from a test for someone who's positive. We moved away from clearing a staff member coming to work with a test, with an additional test. We just do it based on days and following the CDC recommendations.
So my next question is actually about that, about the isolation guidelines, about the CDC recommendations. People are still very confused as to how many days are they supposed to isolate. So can both of you actually pitch in and please tell us about what are the latest guidelines? How long should people isolate after a positive test?
Sure, I can take that one on. So if you became symptomatic before you got your test, so you had symptoms and then you got a test, your day 0 is the day your symptoms started. And, depending on, if you have the ability to wear a really good fitting respirator or mask, then you should isolate for 5 days. And we can put up the CDC guidelines as well. So you should isolate for 5 days. And then continue to wear a mask all the time for another 5 days. If you were asymptomatic, then your day 0 is the day that you had a positive test, and you start counting from there. If you're not able to wear a mask well, or if you're in an environment where there may be a lot of high-risk people, then you might want to consider isolating for a full 10 days. And certainly young kids, will have a hard time, so I think of them as, I wouldn't want to take someone out of isolation for 5 days if it's a young child. Do you have anything to add, Santiago?
No, I just want to distinguish the recommendations for the general public are different from what we do for healthcare workers. So I just wanted to make that comment, because for healthcare workers, we have different categories of staffing that dictate how wide the return to work is, and measuring the other mitigation measures at the hospitals. And so, yeah.
Thank you for that. Dr. Green, one more question is, Omicron is also taking out a lot of, in addition to healthcare workers being on leave, sick leave, a lot of teachers and a lot of students are also, from school, they are out of school, and parents are really nervous about sending their kids to school. What are some of the things that parents can do? And I know we talked about masking and vaccination. What are some of the things the kids can do while in school to have a safe lunch, safety in the classroom, and safety, while playing in the school playground?
Okay. Well, my son is a student of Seattle Public Schools, and I have been impressed with the creativity of the teachers and staff of his school, and I think other neighborhood schools where I know children, to really keep the kids distanced. And so making sure that they're wearing a well-fitting mask, that if their mask, especially if they're wearing these paper masks, that we're recommending, if it gets wet or soiled, they'll need to change their mask. So I always pack a few extra masks in my kid's bag, just to be able to get rid of one and replace it with a new one, to maintain distance, the physical education, the ability for them to kind of come up with new games to get the kids moving around, but keep them away from each other, has been great and really important. And then, a lot of schools are still doing either partly outdoor lunches or utilizing different spaces within the school, so that when kids have to be unmasked while they're eating, that they can still be as safe as possible. And then washing hands frequently. Sorry.
Thank you. Thank you so much. Dr. Neme, the next question is, and that's actually a really popular question that we received. How can masks be reused, especially the upgraded masks that you talked about? Can they be washed? So those are the two very important questions. If you can please address those.
Yeah, thank you. That's a great question. Most masks that are high quality are not washable. So the KN95s, the KF94s, the respirators, they're not washable. So I would recommend against doing that. What we can do and should do is actually reuse them. And I think that not doing that is wasteful. These masks are important, and who knows how long we'll need to use them. And throughout our lives, we will probably have different pandemics and situations where we need to wear them. So, and they're costly, especially for a family that needs to provide masks for the entire family. So what I would say is, one of the key concepts around reuse is that it's not necessarily about the frequency of use that dictates or limits how long I can keep a mask. It's really the time, the actual number of minutes and hours of active use. That is, I can have the same mask for 1 or 2 weeks if I just use it very infrequently, or I would say frequently, but for 5-minute intervals, when I'm answering the door, when I'm going for a walk and I may come very close to a person, right? So I can use that mask that I'm using many times, but for brief amounts of time. But if I wear a mask throughout my workday, I'm wearing it for 12 hours, then that mask has a more limited lifespan. And that has to do with how much wear there is on the actual mask and how the structure of the mask is actually kept intact. I would say the rule of thumb is that most of these masks can last 3 to 5 days. If it becomes soiled, or let's say there's a lot of physical activity, a lot of sweat, for instance, maybe that's a mask that I'm going to put away, and then basically grab it again in a few days once it's dried, as long as the integrity of the mask is intact. But I would say be sure to reuse your mask, and any mask that's saturated but still intact, you may put on a shelf. Some experts say that you should put it inside of a paper bag, a brown paper bag. But if you don't have that, you can actually put it on a high shelf. And as long as there's some good air ventilation for the mask to dry, and then before you put it on in a few days, then you can see the integrity of the mask. And if it's retained, I would continue to use it. Typically, we say 3 to 5 days, but if the activities are really short and brief, you might really extend that. And what I recommend is to, based on a paper that came out from a CDC group a few months ago, is you can safely put even an N95 respirator on a shelf or in a paper bag and reuse 5 days later. So you can technically have just 5 of these masks. You don't need 100, and then you can cycle through. I say the paper bag because that's how it's been studied. I don't have a paper bag at home, so I just put it on a hook at home, and then that's where it is, or they are, because I have bought different kinds, and I'm running low on some product, and it just depends on what you have available at your home.
Thank you, Dr. Neme. That was really, really practical advice on how people can use their upgraded masks, which are more expensive. So will it be practical to say, Dr. Neme, that if we are putting it in a paper bag, then they can date it? This was the date that I used, or this is my grocery store, mask, and this is my mask when I put on if I'm going out, just for a, just to a store, just a short trip. So that would be really valuable advice. And we have information about mask reuse, in the chat as well, where people, can get information on how to put it in a bag. Dr. Neme, can people share masks at home, especially the respirators?
I recommend against that because, again, it's a proximity to a personal, the personal use of a person who is breathing into that mask, and therefore it can lead to transmission in the household. I have picked up by mistake my husband's mask and then realized that, well, it happened, but it was a mistake. So if you have a household of many people, just make sure you know where you put your mask, or label your mask, or have your own hook where you can put your mask. But we should not be sharing masks, especially respirators or KN95s. Yeah.
Thank you so much. One question that we got, a lot of parents ask this question is, at what point, Dr. Green, at what point would you hold your kid back from school?
This is so painful, right? But it happens all the time, right? Just your kid wakes up, they're not quite themselves, they've got a little runny nose, and honestly, they need to stay home, right? Because you need to get them tested, and you need to know whether they have COVID, and it could be just a mild illness. So we are really, yes, there are other respiratory viruses still circulating that are not COVID, but we're seeing such high rates of COVID transmission right now that it's just as likely that it is. And you don't want to send your kid to school to potentially infect the rest of the school and lead to more transmission. So, I'm doing this in my own household, and if your child has mild symptoms, then they should stay home and try to get a test. If you can have a rapid test that you want to give them right there, that's great. If it's positive, you're done. If it's negative though, and they have symptoms, the same thing that Dr. Nimmi said, that's the time to then try to get them to the PCR test. And then, as a healthcare worker, if my child is sick and has a positive COVID test, rapid test, then I'm also staying home, right? Because now I'm on quarantine.
Thank you so much. This was something, that's all so many parents are going through. And it is, like you said, very painful, but at the same time, it's good to know what should the next steps be. So we should try and get them tested right away, when they display symptoms. Here are a few questions, Dr. Nene, about gatherings at this time. And would you, at this point, go out to a restaurant to eat? Would you go to a movie? What is your practical advice to people at this time about these kind of, activities?
Yeah, thank you. First, I would like to frame that some of these answers have to do with your own risk assessment. There are some activities that for someone's well-being are really important. And there are some activities that may be less important. So, and not every activity is framed the same way, depending on the situation, on many things. I would say I'm a fan. One of the things that I miss the most is going to a beautiful restaurant and having a delicious meal over wine. And I love that. But I really haven't done that in a long time. And I would say that I would be open today to going out to an outdoor restaurant, provided that it's really, truly outdoor and not just a tent or something that limits the amount of air, because circulation and ventilation is so key. So I would say today, no indoor restaurants. Yes, truly outdoors, although I haven't, to be completely honest, since early November. But I can see, especially given how sunny it's been, that will happen in the near future, hopefully. But definitely not indoors. And I'm a big takeout person, and I like to support local businesses.
Thank you. Dr. Green, at this time, would you allow your kids to have play dates outside? Would you allow them to participate in school team sports?
I have different answers for those two different questions. In sports, it really depends on what the sport is. I think an outdoor track and field would certainly be something that I would support, or outdoor sports where they can be masked. I probably wouldn't do anything indoor at this time. And that's a big challenge, right? I mean, our kids need this, and they need that social connection. They need that physical activity. So it is not without sacrifice that I make that decision for my family and for what I recommend to friends and family. Play dates, outdoor play dates with a few kids, I think is fine. Again, it's a little bit of a risk, but it's outdoors in general. The kids are all doing a great job wearing masks. So you can still kind of maintain that, especially because they're so excited to see each other. It's really hard to keep them apart. And then, we're not really doing indoor play dates at this time. And then the other thing I try to do is just limit the number of these things per week, mostly because, if there is an exposure, I kind of want to limit the number of families I have to ask or tell. So the idea is if we have an outdoor play date and we wait a few days and make sure everyone is still healthy in all parties, and then maybe do something else the next week.
Dr. Neme, the last question is about people who go to the gym to exercise. Is that okay? Do they have to be masked for exercise? And what are the things that they should take note of in terms of ventilation and spacing?
Yeah, so I'm not an athlete, so going to the gym is not something I miss. But I would say that's an area that, in my mind, is risky because it involves exhalation, it involves being in an indoor space. So I would try to find activities that are outside. But there are ways to do this a bit more safely, which is you want to be masked, you want to make sure that they apply the vaccine policy for everyone, that they're spaced, that they're limited capacity. But I would say we've seen outbreaks associated with going to the gym, yoga classes, and even hot yoga. We've become aware. I do want to say, Dr. Chopra, just to close, and I think it's come up in some of these questions, it's all really about a balance. If going to the gym is the activity that gives you life, try to find a way to do it safely. We know how important exercise is. I feel better after I work out, even if it's just a walk or cycling, whatever it is. I personally have shifted away from obsessing about the end of COVID. And I think that it's important for folks to start thinking of this pandemic or COVID as something that we're living with, and we need to learn about what are the adjustments that we need to make in terms of as opposed to an all or nothing. I think there's a dial, and looking at the case counts in the community, looking at what's going on in other regions, will help inform, like tuning into these conversation sessions. But I think it's important to try to live with this almost as though it's a chronic condition. It's no longer acute. It's something like this achy discomfort that I have in my low back. It's something that I need to nurture, and it's something that's going to be with me. So let's learn to assess these situations and try to find some compromises, because I think that the alternative of being secluded in your own house and not living is not the right choice. I think we could all learn how to find a balance.
So very well put, Dr. Neme. It's really an important reminder for us to, have our own risk assessment, and as well as move safely with layers of protection, and let's just live our lives, as normally as we can. Thank you so very much, Dr. Neme and Dr. Green. Today was a really invaluable session, and I know that all of us are walking away with such wonderful advice about masking, testing, and living with COVID in general. Thank you very much for today's session, and thank you, Priscilla.
Thank you.
Thank you,
Again,
everyone.
the link is in the chat for the recordings of these sessions. Please check back on that page from time to time. We will post when our next session will be hosted. You can also follow us on our social media channels on Facebook, Twitter, and Instagram, and our social media team will be posting these sessions as well. Thank you, everybody. Continue to stay safe and stay healthy, and we'll see you soon.